Greetings, I am Samyo Hangma Rai, and today we're going to study the chapter titled The Acceleration Behind Telehealth Services of Grade 9. So let's begin the class now. The acceleration behind telehealth services. In this interview, Chun Kai Chang, the Business Development Manager of Telehealth at Advantex, talks to News Medical about the acceleration behind telehealth services. To begin, can you give us a brief introduction into telehealth and what it involves? Telehealth is a method of providing medical care remotely, usually through video chat. Telehealth makes it possible to connect patients and clinicians from any location. It provides access to a wide range of care, including primary care consultations, psychotherapy, physical therapy, and even emergency services. It allows primary care clinicians and specialists to further their reach for treating patients wherever there is an internet connection. The benefits of telehealth for healthcare providers and patients is that these services can be faster, safer, more effective, and less expensive in the long run, especially during a time like COVID-19 pandemic, where telehealth has allowed access to medical care without going to hospitals to protect patients and hospital staff from being exposed to the infection. What are some of the main drivers behind the acceleration and momentum of telehealth services? There are two major drivers for this fast-growing market. The first and most recent driver for telehealth has been the global COVID-19 pandemic. Strong social distancing and minimal physical contact precautions have pushed the shift to telehealth and remote consultations as it aids in infection protection. These precautions and increased hospital bed shortages have forced medical facilities to incorporate more telehealth technologies to keep up with the demand and maintain care continuity for patients at home. The second driver is the shortage of medical professionals when demand is increasing every year due to an aging population and more patients with chronic and non-communicable diseases. For people living in rural areas, their medical demands are undeserved due to insufficient resources and long distances to drive into cities for care. Telehealth is one of the promising ways to tackle the challenge of doctor shortages and expand. In terms of this acceleration and momentum of telehealth services we are currently seeing, what are some items we can expect to see in the future? Telehealth will not replace face-to-face care services, but we will incorporate it into healthcare facilities infrastructure. Patients will be selecting providers based on their accessibility to telehealth services. With more access to doctors, increasing patients using preventative care services and follow-up care due to convenience will start to emerge. These can lead to fewer readmissions and patient complications. We will also see more use for early screening of patients' triage in the field before they arrive at hospitals. When it comes to remote patient monitoring for clinicians, what impact does telehealth have on this? Remote patient monitoring could be one of the applications of telehealth. Remote patient monitoring usually involves continuously collecting patients' health data through wearable devices such as vital signs and blood sugars. The patient's data is then transmitted in real time, monitored, and reviewed by medical providers. In this way, medical providers could acquire a whole picture of a patient's health condition and give a more precise diagnosis. How has telehealth shaped the way clinicians work with each other? Clinician to clinician, telehealth services have enabled medical professionals to collaborate virtually with specialists in other locations to deliver treatment and care to patients jointly. This service can range from remote surgical mentoring to tele-ICU and tele-ER, like a stroke, in which on-site staff work together with a remote physician specialist team to assess patients' condition. Telehealth solutions relieve the pressure of staffing gaps seen in critical departments such as an emergency room and ICU. What would you say are some of the biggest challenges clinicians currently face with telehealth? Many hospitals are still facing the lack of infrastructure to implement telehealth successfully, insufficient hardware, and the right technology for each specialty. Some hospitals struggle with reliable networking infrastructures like broadband, 4G, or Wi-Fi. This could limit the connectivity within facilities and provide remote care to rural areas or mobile clinics. Having the right technology and tools in place will be crucial to successful telehealth programs. Even though this new technology is quickly being integrated, there is a learning curve to using telehealth versus traditional healthcare operations. Users face obstacles such as learning to use different tools, online scheduling for virtual visits, triage procedures, and billing policies. To overcome these challenges, telehealth should be encouraged as a regular service and included in health insurance. There would be more motives for healthcare providers to invest in infrastructures and information system integration and deploy telehealth technology. The acceleration behind telehealth services. Chun Kai Cheng, who is a business development manager at Advantech, talks about telehealth services. So, telehealth is a method of providing medical care remotely online. The telehealth services rose in popularity due to the COVID-19 pandemic. This could revolutionize healthcare accessibility. More access to doctors, patients use preventive care and have a lot of follow up options as well. So, medical professionals are also able to collaborate with one another virtually, regardless of the distance between them. It also helps in monitoring and mentoring. Additionally, however, the lack of infrastructures to implement telehealth successfully is quite a huge gap. Users might face the obstacles of using tools for the payment as well as for scheduling. And to ensure that telehealth is used more, it needs to be encouraged more. Homework. Why is implementing telehealth services in Nepal difficult? And write about the benefits and challenges of telehealth services. How was your class today? If you have any feedback or suggestions, please feel free to write to us at learning@dearwalk.edu.np. See you in the next class with another lesson. Thank you.